What tests confirm a lupus diagnosis? When it comes to diagnosing lupus, it can be quite a puzzle. The symptoms vary widely and can mimic other conditions, making it tricky for healthcare providers. To confirm a lupus diagnosis, a combination of clinical evaluation, laboratory tests, and sometimes imaging studies is essential. Let's break down the key tests involved in this process. First, a thorough clinical evaluation is crucial. This involves a detailed medical history and a physical examination. Healthcare providers will look for specific symptoms that are commonly associated with lupus, such as joint pain, skin rashes, and kidney issues. Next, laboratory tests play a vital role in confirming the diagnosis. One of the most common tests is the antinuclear antibody, or ANA test. Most people with lupus will have a positive ANA result, but it's important to note that a positive result alone does not confirm lupus, as it can also be present in other conditions. More specific tests include the anti-double-stranded DNA and anti-Smith antibodies. The presence of these antibodies can help confirm a lupus diagnosis. Additionally, checking complement levels is important. Low levels of complement proteins like C3 and C4 can indicate active lupus. A complete blood count, or CBC, is another important test. It can reveal anemia, low white blood cell counts, or low platelet counts, all of which are common in lupus patients. Inflammation levels in the body can be assessed through tests like the erythrocyte sedimentation rate or C-reactive protein test. Sometimes, imaging studies are necessary to evaluate any organ damage, especially in the kidneys and brain. Common imaging tests include X-rays, ultrasounds, and MRI scans. In certain cases, a biopsy may be needed. This involves taking a small sample of skin or kidney tissue to confirm the diagnosis and assess the extent of any organ involvement. Lastly, lupus anticoagulant testing is used to detect the presence of lupus anticoagulant, which can increase the risk of blood clots. Diagnosing lupus involves meeting specific criteria set by organizations like the American College of Rheumatology or the Systemic Lupus International Collaborating Clinics. These criteria include a mix of clinical signs and laboratory findings. It's essential to remember that lupus is complex, and no single test can confirm the diagnosis. A healthcare provider will consider all these factors to make an accurate diagnosis and create a suitable treatment plan. If you suspect you may have lupus, it's crucial to consult with a healthcare professional for personalized advice.